so that you can watch this video with desired speed to cover all topics for your MCPS as well as MRCGP South Asia International exam, because these are very high yield topics. So I'm trying my very best to convey this PDF format in video. Okay, thank you. So alright, I'll start from diabetes mellitus. Okay, so diabetes mellitus, management of type 1 and type 1 diabetes. The long-term management of type 1 diabetes and diabetics is an important and complex process requiring the input of many different clinical specialists and members of the healthcare team. And a diagnosis of type 1 and diabetes can still reduce the life expectancy of patient by 13 years, and the micro and macrovascular complications are well documented. Okay. So NICE released guidelines on the diagnosis and management of type 1 diabetes 2015, and we have only highlighted a very select amount of the guidance here, which will be useful for any clinician looking after a patient with type 1 diabetes. Okay, so only important topics are discussed here. Okay, so HbA1c, we'll talk on the HbA1c. So HbA1c should be monitored every 3 to 6 months. Adults should have a target of HbA1c level 48 millimole per mole, that is 6.5% or lower. And NICE do however recommend taking into account factors such as the person's daily activities, aspirations, likelihood of complications, comorbidities, occupation, and history of hypoglycemia. Okay, so these things I should keep in mind. Okay, and self-monitoring of blood glucose. So also it is recommended testing at least 4 times a day. Okay, including before each meal and before bed. Okay, so 4 times a day. These every point of this PDF are high yield. Every line, yeah, you can have in you'll have MCQ on it. Okay, so you should read and listen carefully. This PDF is very important, I would say. Yeah. More frequent monitoring is recommended if frequency of hypoglycemic episodes increases during periods of illness, before, during, and after sport, while planning pregnancy, during pregnancy, and whilst breastfeeding, because in these factors there is high chances of hypoglycemic episodes. Okay, and then blood glucose targets 5.7 millimole on waking, and should be 4.7 millimole per liter before meals at other times of the day. Okay, and type of insulin offer multiple daily injections, basal bolus injection regimes rather than twice daily mixed insulin regimes as the insulin injection regime of the choice for all the adults. Okay, and twice daily insulin determine is the regime of choice. Once daily insulin glargine or insulin determine is an alternative. Okay, so regime of choice is determine, and twice daily insulin determine. Offer rapid acting insulin analogs injected before meals rather than rapid acting soluble human or animal insulins for mealtime insulin replacement for adults with type 1 diabetes. Metformin, NICE recommended considering adding metformin if the BMI is more than 25 kilogram per cube. Okay, and let's come to the types. Moody, maturity onset diabetes of the young. Okay, so Moody is characterized by the development of type 2 diabetes in patients less than 25 years old. It is typically inherited in an autosomal dominant condition. Over 6 different genetic mutations have so far been identified as leading to Moody. Okay, so it is started around 22% of patients with diabetes mellitus have Moody, and around 90% are misclassified as having either type 1 or type 2 diabetes mellitus. Okay, so as I stated earlier that it is Moody as Moody is type 3 and Moody 2. Okay, so Moody 3 is 60% of cases are Moody 3, and these are so majority of cases are due to defect in HNF1 alpha gene. Okay, and rest 20% of cases are Moody 2 due to defect in glucokinase gene. Okay, so features of Moody are typically developed in patients Aged less than 25 years, a family history of early onset diabetes is often present. Ketosis is not a feature of presentation, and patient the most common form of very sensitive to sulfonylureas. Insulin is not usually necessary. Okay. So now come to the diabetes, pre-diabetes and impaired glucose regulation. So again, important. Everything in this PDF is important. These are high yield topics. Okay, so pre-diabetes is a term which is increasingly used where there is impaired glucose levels which are above the normal range but not high enough for diagnosis of diabetes mellitus. So the term includes diabetes patients who have been labeled as having either impaired glucose fasting glucose IFG or impaired glucose tolerance IGT. Okay, so UK diabetes UK estimate that around 1 in 7 adults in the UK have prediabetes. Many individuals with prediabetes will progress under developing type 2 diabetes mellitus, and they are therefore at greater risk of macrovascular and microvascular complications. So terminology and diabetes UK currently recommended using the term pre-diabetes when talking to patients and impaired glucose regulation than talking to other healthcare professionals. Okay, so research has shown that the term pre-diabetes had the most impact and is most easily understood. And identification of patient with diabetes is NICE recommended using a validated computer-based risk assessment tool for all adults aged 40 and over, people of South Asian and Chinese descent aged 25 to 39, and adult with condition that increase the risk of type 2 diabetes. And patients identified at high risk should have a blood sample taken. And fasting plasma glucose of 6.1 to 6.9 millimole per liter, or HbA1c level of 42 to 47 millimole per mole, which is 6.0 to 6.4% indicates high risk. Okay, so normal glycemic control is less than 6 millimole. Okay, fasting and HbA1c should be less than 41 millimole per liter and 5.9%. Okay, but it is between, if the fasting glucose is between 6.0 millimole to 7.0 millimole, then it will be considered as pre-diabetes. Okay. So HbA1c is 42 to 47 millimole, that is 6.0 to 6.4%. Our fasting glucose 6.1 to 6.9 millimole per liter, so it will be considered as pre-diabetes. But if the fasting glucose is more than 7 and the HbA1c is more than 48 millimole per mole, and that is 6.5%, then it will be labeled as diabetes mellitus. Okay, so I hope it is I made clear for you. So let's come to the management. So lifestyle modification is the crucial. In lifestyle modification, I'll advise weight loss, increase exercise, and changing diet. At least yearly follow-up with the blood test is recommended. And NICE recommended metformin for the adults at high risk whose blood glucose, fasting plasma glucose, or HbA1c shows they are still progressing toward type 2 diabetes despite their participation in an intensive lifestyle change program. Okay, so impaired fasting glucose and impaired glucose tolerance, there are two types of IG or impaired glucose. So impaired fasting glucose due to hepatic insulin resistance, impaired glucose tolerance due to muscle insulin resistance, and patients with IGT are more likely to develop type 2 diabetes mellitus and cardiovascular disease than patients with impaired fasting glucose. Okay, so that means due to hepatic insulin resistance. Okay. So those due to muscle insulin resistance are more prone to type 2 diabetes mellitus and cardiovascular diseases are common. And so definitions of fasting glucose greater than or equal to 6.1 but less than 7.0 millimole per liter implies impaired fasting glucose. Okay, so 6.1 to 6.9. Okay, And impaired glucose tolerance is defined in fasting plasma glucose less than 7 millimole, or oral glucose tolerance test and to a value greater than or equal to 7.8 millimole per liter but less than 11.1 millimole per liter. Okay, so people with IFT should then be offered an oral glucose tolerance test to rule out a diagnosis of diabetes. Result below 11.1 millimole per liter but above 7.8 millimole per liter indicates the person doesn't have diabetes but does have impaired glucose tolerance. Okay, so I'll create another video to continue this PDF. I hope it is helpful for you. And yeah, share your feedback also. Jazakallah khairan. Assalamu alaikum.